According to the American Heart Association, nearly half of all American adults, approximately 122 million people, have high blood pressure, with a startling 75% of them relying on medication to manage it. However, despite consistent medication use, these drugs are not effectively controlling the disease, as evidenced by the fact that over 675,000 Americans die annually from hypertension-related complications. I'm Dr. Michael Kent, and after more than 2 decades of performing cardiac surgery, I can explain exactly why these medications often fail. The conventional understanding of high blood pressure is fundamentally flawed and incomplete. Traditionally, hypertension has been viewed as a problem of excess fluid volume in the circulatory system, hence the advice to reduce sodium intake and use diuretics to remove excess water, which lowers blood pressure readings and is assumed to solve the issue. But this outdated framework, rooted in medical thinking from over 50 years ago, does not address the true nature of the problem and keeps millions of people sick even when their monitored numbers appear controlled. The reality is far more complex. Hypertension is not about too much fluid in the arteries, but rather about the arteries themselves. They are damaged, deteriorating, and rigid due to structural changes at the cellular level, changes that no prescription medication can reverse. When I perform bypass surgery, I observe this damage firsthand. A healthy artery is elastic and springs back when incised, whereas an artery from a patient with chronic hypertension feels stiff and calcified, almost like cutting into bone. This rigidity is the true hallmark of hypertension, and while medications may lower the numbers on your blood pressure monitor, they do nothing to repair this underlying structural damage. By the end of this discussion, you will learn about the 4 hidden mechanisms that cause hypertension and a comprehensive 4-step protocol designed to reverse arterial damage at the cellular level. This involves an understanding of cellular biology and biochemistry, beginning with what hypertension really means at the cellular level. Your arteries are complex living structures composed of 3 distinct layers, with the innermost layer, the endothelium, lining every blood vessel and directly contacting flowing blood. This single-cell thick layer, thinner than tissue paper, is much more than a physical barrier. It acts as a dynamic metabolic organ that produces chemical signals to regulate blood flow, prevent inappropriate clotting, control inflammation, and maintain vessel health. Covering the endothelium is a protective microscopic coating called the glycocalyx, which functions like a non-stick surface on the interior of your arteries. Composed of sugar molecules and proteins only a few micrometers thick and invisible to the naked eye, the glycocalyx plays a crucial role in cardiovascular health. Research published in 2007 in Pfluger's archive demonstrated that the glycocalyx creates a smooth, frictionless surface to allow unimpeded blood flow, prevents inflammatory molecules from attaching to the vessel wall, and senses changes in blood flow to trigger the release of nitric oxide, a gas molecule essential for keeping vessels relaxed and dilated. When the glycocalyx remains intact and healthy, your arteries maintain their flexibility, elasticity, and function properly. But when it becomes damaged or breaks down, the entire system begins to fail, leading to progressive arterial stiffening and increased risk of cardiovascular events. Elevated blood sugar levels, chronic systemic inflammation, cigarette smoking, and oxidative stress gradually erode the protective glycolic layer on your blood vessels, much like acid dissolving a coating that shields the surface. Once this glycolic layer is damaged, the vessel walls become exposed and highly vulnerable to harm. Inflammatory molecules circulating in your bloodstream begin to attach to the endothelial lining of your vessels. White blood cells then stick to these damaged areas, while LDL cholesterol particles penetrate into the vessel tissue, initiating the formation of atherosclerotic plaque. Consequently, the endothelium's ability to produce sufficient nitric oxide diminishes, causing the blood vessels to constrict and lose their natural flexibility. This results in an increase in blood pressure, marking the first significant mechanism behind hypertension, the destruction of glycolyx and damage to the endothelium. It is crucial to understand that no blood pressure medication, including ACE inhibitors, beta blockers, calcium channel blockers, or diuretics, can repair this damage to the glycolic layer. These drugs may help control your blood pressure readings, but they do not reverse the underlying endothelial damage. As a result, even if your numbers appear well managed on medication, your blood vessels remain compromised, vulnerable, and silently progressing towards serious cardiovascular events such as strokes or heart attacks. This explains why individuals taking blood pressure medications can still suffer from heart-related complications. The medications address the symptoms, but not the root cause. The second key mechanism involves arterial stiffness and calcification, which is often overlooked by physicians who tend to focus solely on blood pressure numbers without considering whether the arteries themselves are flexible or rigid, a distinction that is more important than the numbers alone. A systematic review and meta-analysis published in the Journal of the American College of Cardiology in 2010 demonstrated that arterial stiffness is a stronger predictor of cardiovascular events and all-cause mortality than traditional blood pressure measurements. Blood pressure is recorded as two numbers, systolic over diastolic, and the difference between these two, known as pulse pressure, provides insight into arterial stiffness. Normally, pulse pressure ranges between 40 and 50 millimeters mercury. However, as arteries stiffen due to aging or disease, systolic pressure rises while diastolic pressure falls, resulting in a widened pulse pressure. For example, a reading of 162 over 72 millimeters mercury yields a pulse pressure of 90 millimeters mercury, indicating stiff, calcified arteries. This means the aorta has lost its elasticity and ability to absorb the shock of each heartbeat. A 2006 expert consensus document in the European Heart Journal highlighted that arterial stiffness can be directly measured using a test called pulse wave velocity, which assesses how quickly a pressure wave travels through your arteries. In healthy, flexible arteries, this wave travels relatively slowly, about 6 to 7 meters per second, whereas in stiff, diseased arteries, it speeds up to 12 to 15 meters per second. The faster the wave velocity, the stiffer the arteries, and the greater the cardiovascular risk. Although this non-invasive test is quick, taking only around 10 minutes, it is rarely ordered by physicians because there is no medication that directly reverses arterial stiffness. Research published in the American Journal of Hypertension in 2004 emphasized that current pharmaceutical treatments fail to address the fundamental structural issues causing vascular stiffening and elevated systolic blood pressure. To understand arterial stiffness at the tissue level, one must consider the artery wall's three distinct layers: the innermost intima, the middle tunica media, and the outer tunica externa. The tunica media, which contains smooth muscle cells and elastic fibers, is responsible for the artery's flexibility and its ability to expand and contract with each heartbeat. When this layer becomes compromised, the arteries lose their elasticity, leading to increased stiffness and a higher risk of cardiovascular problems. As you age, especially if you have chronic conditions such as hypertension or diabetes, a complex array of damaging processes progressively impair the tunica media, the crucial middle layer of the blood vessel wall responsible for maintaining elasticity and structural integrity. Under normal circumstances, this layer contains smooth muscle cells and elastic fibers that work synergistically to allow vessels to expand and contract rhythmically with each heartbeat. This dynamic flexibility plays a vital role in regulating blood flow and maintaining stable blood pressure. However, chronic inflammation, often driven by systemic factors like oxidative stress, metabolic imbalances, and immune system activation, triggers abnormal deposition of calcium salts within the vessel walls, a pathological process known as vascular calcification. This calcification results in the stiffening of the blood vessels, severely reducing their ability to dilate appropriately in response to physiological demands. At the cellular level, oxidative damage degrades the elastic fibers, which are then replaced by collagen fibers that are far less elastic, further compromising vessel compliance. Moreover, smooth muscle cells within the tunica media can undergo a phenotypic transformation into osteoblasts-like cells, which produce bone matrix proteins that accelerate the calcification process and disrupt normal vascular function. A comprehensive 2019 review by the American College of Cardiology identified vascular calcification as the primary driver of arterial stiffness, a condition that significantly elevates cardiovascular risk. By the time individuals reach age 65, some arteries have undergone such extensive calcification that they become almost bone-like in texture and lose their essential flexibility, contributing to hypertension and increasing the workload on the heart. While pharmacological interventions such as ACE inhibitors and calcium channel blockers are effective in managing symptoms and controlling blood pressure, they do not reverse the underlying calcification or restore the vessel's original elasticity. Emerging research indicates that nutrition and lifestyle interventions may hold promise in mitigating or potentially reversing vascular calcification. Nitric oxide, NO, a critical signaling molecule produced by endothelial cells lining the blood vessels, plays an essential role in mediating vessel dilation and blood pressure regulation. Reduced bioavailability of nitric oxide, often due to endothelial damage and impairment of the protective glycocalyx layer, leads to vessel constriction, elevated blood pressure, and increased vascular stiffness. The enzyme endothelial nitric oxide synthase, ENOS, catalyzes the production of nitric oxide, but requires vital cofactors such as tetrahydrobiopterin to function properly. When BH4 levels are insufficient, ENOS becomes uncoupled, producing harmful reactive oxygen species instead of nitric oxide, thereby exacerbating oxidative stress and vascular dysfunction. Shear stress generated by blood flow acts as a natural activator of ENOS, which explains why cardiovascular exercise that increases blood flow is particularly effective in lowering blood pressure and improving vascular health. A 2014 meta-analysis demonstrated that isometric resistance training significantly reduces blood pressure by enhancing nitric oxide bioavailability and improving endothelial function. These detailed insights underscore the importance of a multifaceted approach, combining lifestyle modifications, targeted nutritional strategies, and medical management to preserve vascular health, slow or prevent arterial stiffness, and ultimately reduce cardiovascular disease risk as we age. The protocol under examination involves gripping a hand grip device at 30% of your maximum strength for 2 minutes, followed by a 1-minute rest, and repeating this cycle 4 times. Clinical studies have consistently shown that practicing this exact regimen for 8 weeks can reduce systolic blood pressure by 8 to 12 points. Moving on to the fourth and final mechanism, the connection between insulin and the kidneys explains why simply lowering sodium intake often fails to improve hypertension for many individuals. Blood pressure regulation is largely controlled by the kidneys through sodium balance, but this mechanism only works properly if the kidneys respond appropriately to sodium consumption. The critical issue is that insulin inhibits sodium excretion by the kidneys. When insulin levels are chronically high, the kidneys retain sodium regardless of intake. A seminal 1987 study in the New England Journal of Medicine established that insulin resistance is present in essential hypertension and plays a causal role in elevating blood pressure. Insulin affects the kidneys through several pathways. It directly stimulates sodium reabsorption in the proximal tubule of the nephron, meaning more sodium is retained in the bloodstream and less is excreted in urine. It activates the sympathetic nervous system, prompting the kidneys to release renin, which triggers a hormonal cascade culminating in aldosterone release. Aldosterone signals the kidneys to retain sodium and excrete potassium. And it increases blood vessel sensitivity to angiotensin II, a potent vasoconstrictor. A landmark 1991 study published in Diabetes Care described insulin resistance as a multifaceted syndrome responsible for hypertension, obesity, dyslipidemia, and atherosclerotic cardiovascular disease. This explains why individuals with insulin resistance, prediabetes, or type 2 diabetes almost invariably develop hypertension, as elevated insulin locks their kidneys in a continuous sodium retentive state. Importantly, many people don't realize that significant insulin resistance can exist without diabetes. Their fasting blood glucose and hemoglobin A1C may be normal, yet their insulin levels can be substantially elevated, silently driving their hypertension. Most physicians only check glucose and A1C, assuming normal results mean insulin levels are fine, which is often incorrect. To reverse these mechanisms, a comprehensive 4-step protocol is necessary. The first step is restoring the glycocalyx, beginning with halting its destruction. Elevated blood sugar and oxidative stress are major factors damaging the glycocalyx, particularly when blood sugar spikes above 145, causing glycation that harms this delicate structure. Stabilizing blood sugar, not merely avoiding diabetes, but consistently keeping post-meal blood sugar below 140, is essential. For most people, this involves significantly reducing refined carbohydrates, not eliminating all carbs, but choosing those that don't cause dramatic blood sugar spikes, such as whole foods, non-starchy vegetables, legumes, and some fruits, while avoiding sugar, white bread, white rice, pasta, and baked goods. The second step is supplying the building blocks necessary for the body to rebuild the glycocalyx. This structure primarily consists of glycosaminoglycans, long chains of sulfated sugar molecules, with the best dietary sources being sulfated polysaccharides found in seaweed, particularly fucoidan from brown seaweed. Research has demonstrated that these compounds can restore glycocalyx thickness and improve endothelial function, and supplements containing fucoidan are commercially available. Research demonstrating benefits typically involves daily doses ranging from 600 to 1,000 milligrams. A crucial step is significantly reducing oxidative stress, and the most effective antioxidants for vascular health are polyphenols, found in colorful vegetables and fruits, berries, dark leafy greens, beets, dark chocolate, and green tea. These foods contain compounds that neutralize free radicals before they can harm your glycolytic processes. For example, consider a 71-year-old individual who has had hypertension for 13 years and was on 2 medications. Although their blood pressure was controlled at 130/82, lab tests revealed elevated markers of endothelial dysfunction. This person began a protocol that eliminated all refined carbohydrates, introduced an 800 milligrams daily fucoidan supplement, and significantly increased polyphenol-rich foods by consuming a cup of mixed berries and 2 cups of leafy greens each day. After 12 weeks, endothelial function tests showed an improvement in dilation from 5% to 13%, and blood pressure decreased from 130/82 to 116/74. After 6 months, 1 medication was reduced, and eventually, the individual was off both medications entirely, with blood pressure remaining stable at 120/76. Moving to the second step, decalcification involves removing calcium from artery walls to restore flexibility. Many assume that calcium deposits in arteries are permanent and irreversible, but this is incorrect. The key protein responsible for this process is matrix glycoprotein, MGP, which acts like a traffic controller for calcium. When MGP is properly activated, it directs calcium to the bones where it belongs. If not activated, calcium deposits in artery walls. Activation of MGP requires vitamin K2, specifically the MK7 form. Studies such as one published in Atherosclerosis in 2009 demonstrated that high dietary intake of menaquinone correlates with reduced coronary calcification. And the Rotterdam study from 2004 linked dietary menaquinone intake with a lower risk of coronary heart disease. Without sufficient vitamin K2, MGP remains inactive, allowing calcium to accumulate in arteries, but with adequate vitamin K2, MGP activates and redirects calcium from arteries to bones, potentially reversing arterial calcification. Effective doses of MK7 range from 180 to 360 micrograms daily. However, vitamin K2 alone isn't enough. Calcium requires vitamin D to effectively enter bone tissue, as vitamin D enhances calcium absorption from the digestive tract and helps incorporate it into the bone matrix, so both nutrients must work in tandem. Magnesium is the third critical component, acting as nature's calcium channel blocker. Adequate magnesium levels prevent calcium from entering smooth muscle cells and vessel walls inappropriately, avoiding vessel constriction and high blood pressure. When magnesium is deficient, calcium floods these cells, causing vessels to constrict and blood pressure to rise. Magnesium also inhibits calcium crystallization and plaque formation in vessel walls. Most people are deficient in magnesium because it is primarily found in dark leafy greens, nuts, seeds, and whole grains, and this deficiency is exacerbated by factors like chronic stress, alcohol consumption, diuretic medications, and proton pump inhibitors used for acid reflux. The recommended solution is supplementation with highly absorbable forms of magnesium, such as magnesium glycinate or magnesium threonate, with doses between 400 and 600 milligrams daily for cardiovascular health. For instance, a 74-year-old with hypertension for 18 years, taking 4 medications and with barely controlled blood pressure at 136/86, had a CT scan revealing severe calcification throughout the aorta. This individual began a decalcification protocol, including 360 micrograms of vitamin K2 daily, 6,000 international units of vitamin D daily, and 600 milligrams of magnesium glycinate daily. After 6 months, a CT scan revealed a 9% reduction in the calcification score, while blood pressure improved to 122/78, allowing a reduction from 4 medications to 3. After 1 year, the calcium score had decreased by 16%, and by 18 months, the patient was on just 1 medication, with excellent blood pressure control. The third step focuses on restoring nitric oxide. beginning with protecting and enhancing BH4, a vital cofactor for the endothelial nitric oxide synthase (eNOS) enzyme. Adequate intake of folate, vitamin C, and vitamin E is essential, as these vitamins help regenerate BH4 and prevent eNOS uncoupling. Folate is abundant in dark leafy greens, vitamin C in citrus fruits, berries, and bell peppers, and vitamin E in nuts and seeds. A 1999 study published in the Journal of Cardiovascular Pharmacology demonstrated that oral vitamin C reduces arterial stiffness in humans. Next, stimulating eNOS through shear stress can be effectively achieved via isometric hand grip training, squeezing a hand grip device at 30% of maximum strength for 2 minutes, resting for 1 minute, and repeating this cycle 4 times a week. Additionally, practicing nasal breathing is important because it increases blood nitric oxide levels by up to 400% compared to mouth breathing, as nasal passages produce nitric oxide. The fourth step is the insulin reset, which unlocks the kidney's ability to excrete sodium properly. Elevated insulin keeps the kidneys in sodium retention mode, so lowering insulin levels is crucial. Time-restricted eating is the most effective strategy, involving consuming all food within a specific daily window and fasting during the remaining hours. For those with hypertension, a 16-hour fast with an 8-hour eating window from noon to 8 p.m. is recommended, drinking only water, black coffee, or plain tea with no calories during the fasting period. Research shows that time-restricted eating can lower systolic blood pressure by 9 to 11 points within 8 weeks, without changing diet composition. The mechanism is insulin-related. Lower insulin unlocks kidneys, enabling proper sodium excretion, which normalizes blood pressure. Improving insulin sensitivity at the cellular level is also vital, and resistance training is the best way to achieve this. Regular resistance exercises increase muscle insulin receptors, and studies indicate that resistance training 2 to 3 times a week reduces fasting insulin by 20 to 30% within 12 weeks. This comprehensive approach is what true hypertension reversal looks like, not just managing symptoms temporarily or controlling numbers with medication, but permanently fixing the underlying causes, restoring glycolysis, decalcifying arteries, enhancing nitric oxide production, and normalizing insulin. Addressing these root causes allows blood pressure to normalize naturally, as the body heals itself when given the right conditions. Begin with the step that resonates most with you. If you consume refined carbohydrates and sugary foods, start with glycolysis restoration by stabilizing blood sugar. If overweight or showing signs of insulin resistance, start with the insulin reset through time-restricted eating. If rarely exercising, start nitric oxide restoration with isometric training. It's important not to stop blood pressure medication abruptly, as this would be dangerous. Medication manages symptoms, while these protocols address the root causes. Implement these steps while continuing your current medication for the best outcome. As your blood pressure improves over weeks and months, work closely with your physician to safely reduce medication under medical supervision, avoiding adverse effects. Regularly monitor your blood pressure at home with a reliable device, keeping detailed records to guide treatment adjustments. Once readings stabilize within a healthy range, discuss tapering medication with your doctor. Never stop or reduce medication on your own, as abrupt changes can cause serious risks like rebound hypertension. Hypertension medication controls blood pressure temporarily, but often doesn't address root causes like glycation, arterial calcification, nitric oxide deficiency, and insulin kidney dysfunction that sustain high blood pressure. Targeting these issues can help reverse hypertension by repairing your vascular system at cellular and molecular levels. While standard care manages symptoms, an integrative approach, controlling blood sugar with sulfated polysaccharides and antioxidants, promoting arterial decalcification with vitamins K2, D, and magnesium, restoring nitric oxide through exercise and nasal breathing, and improving insulin sensitivity via time-restricted eating and resistance training can reduce medication reliance and prevent hypertension-related complications. Incorporating lifestyle changes beyond medication improves blood pressure and overall cardiovascular health. Consistent physical activity, a balanced diet of whole foods, and stress management, like mindfulness or yoga, support vascular repair. Regular check-ins with healthcare providers ensure personalized adjustments, making treatment safer and more effective. Empower yourself with knowledge and proactive habits to reclaim your health and reduce medication dependency. Remember, your blood vessels are vital and irreplaceable. Hypertension is reversible if you address its causes thoughtfully and consistently. Ultimately, the choice is yours. Pursue true healing and long-term wellness, rather than lifelong symptom management.